So I have no financial disclosures. So we really started with the question of whether or not men can modify their risk of prostate cancer recurrence after prostatectomy. We know that obesity measured at or near the time of prostatectomy has been associated with an increased risk of prostate cancer recurrence, and we wanted to explore this further and think about the relevant timing of obesity. So more specifically, does obesity in the years prior to or after surgery also influence risk of recurrence? Does weight change in the time period around surgery influence the risk of recurrence? And does physical activity modify the obesity-related risk of recurrence? So to do that, we started with about 2,500 men. All of them had clinically localized disease, and they all underwent radical prostatectomy performed by one surgeon at Johns Hopkins Hospital. They were followed annually by the surgeon for recurrence. And in 2007, we sent about 2,000 of these men who were still alive and living in the United States a survey where we asked them about lifestyle factors, medical factors, and other dietary factors. So for this analysis, we were interested specifically in the time point at 5 years before surgery and then again 1 year after, in which men gave us their self-reported height, weight, and activity level. So in 2009, we had 1,337 men with complete information. And what we found was that at 5 years before surgery, as compared to normal weight men, men who were obese did not have an increased risk of recurrence. However, at 1 year after, men who were obese as compared to normal weight men did have an increased risk of recurrence. So then we looked at weight change. So for this analysis, we defined maintenance as maintaining the same body weight, give or take about 5 pounds. So for men who gained more than 5 pounds from 5 years before surgery to 1 year after surgery, they were at a twofold increased risk of prostate cancer recurrence as compared to men who maintained their weight. So the next question we asked was whether or not physical activity modified this association. So we defined active men as men who participated in 5 hours or more of physical activity each week. So for obesity, we saw that in men who were active, the association was attenuated, so they appeared to have a lower risk. However, for men who gained weight, this association was not attenuated in active men. So, in conclusion, we conducted a retrospective cohort study, and we saw that weight gain may increase the risk of prostate cancer recurrence after prostatectomy, and that obesity, especially among inactive men, may also contribute to the risk of prostate cancer recurrence after prostatectomy. And so our take-home message here is really that by avoiding obesity and weight gain, men with prostate cancer may be able to both prevent recurrence but also improve their overall well-being.
Thank you very much.